Welcome back to another session of Tales from the Table. Again, because this is a relatively new series, we are going to go all the way back to 2017, early 2018, somewhere around there. I was working with a young gentleman about 24 years old. He had called me up, said that he had just this nagging back pain that he could not get rid of. He went to several other practitioners, chiropractors. He was thinking about getting an epidural, and he was just at the end of his rope, and he figured that he was too young really for any of these things to happen. And I absolutely agreed. So he came in 3 times, and each time I did all my checks. I went up, I went down from wherever his pain was. I was pretty much looking at everything everywhere, and he was only slightly getting better. And I just didn't understand it. I was super confused, a little bit frustrated. And this guy, he had a full time job working at a dive shop. So it's not like he's making, even hundreds of thousands of dollars. And I back then I was still even charging a pretty penny. So he had kind of alluded like, look, I'll give it one more chance, but if we can't nail it this time, like I'm probably just going to have to go somewhere else. And I 100% agreed. If I can't help people within at least 4 sessions, if I can't reduce your pain by at least 50% in 4 sessions, whether we're working here in my office or online together remotely, if I can't reduce your pain by between 35 to 50% in 4 sessions, then absolutely I'm off the mark. I need to figure something out or figure where it's coming from, find out where it's coming from. Or, we just agree, hey, this isn't right for you and I'm not your guy. I can't figure it out either. I'm really sorry. And you just go about your way. Now, thank goodness I haven't really had to say that to too many people. There are only 2 people in my practice through the years that I haven't been able to help. And even we parted as friends and they just agreed like, yeah, this obviously isn't your fault. And they were just going to keep on keeping on and see if they would get better. But back to this gentleman. So the 4th session that we have, he comes into my apartment. This is back in the day when I was working out of my apartment. And when he walks in, he takes his keys, his wallet, and his phone out of his right back pocket, and he ends up putting it on the counter before he gets on the table. And I looked at him and I was like, dude, do you keep all of that stuff in your back pocket while you are driving? And he just kind of looked at me like, yeah, like, doesn't everybody? Now, my dad used to do this too. My dad's wallet literally was just sandwiched into his back pocket. And you would take the wallet out of his back pocket and it was just like super compressed. It was a leather wallet, but it was super compressed from him always sitting on it. My dad also played a lot of golf. My dad had 4 back surgeries. He didn't want to listen. I didn't have a white coat, so he did not want to listen to me in order to get his back better, even though I knew what was going on. I kind of looked at this kid and I was like, you put everything in your back pocket and then you sit on it? And he's like, yeah. And I'm like, how long is your commute to the dive shop? He said 45 minutes. He lived in Hollywood and the dive shop was in Deerfield. And I was like, you have got to be kidding me. It's 45 minutes there and 45 minutes back. So for an hour and a half, this kid is sitting on his wallet and his cell phone and his keys, okay, while he's driving. Then who knows how long he's sitting on it when he's at the dive shop. And I just looked at him and I said, okay, this is going to be number 1. Don't ever put anything in your back pocket anymore. Women, you need to be careful about always wearing a backpack or a purse on the same shoulder, because then what ends up happening? We get a high shoulder as a result. Okay. So I told him, first things first, you need to not put anything in your back pocket, because whatever I'm doing just gets completely erased when you go and you sit and you're like this. One hip is going to be higher. Wherever that stuff is in your back pocket, one hip is going to be higher and the other hip is going to be normal. And that's what's contributing to your back pain. So he got on the table and I decided to be a little bit more curious this time. Got him on his side and I start working in his hip and it feels a little bit tight, but not that bad. I go around the greater trochanter, the bone of the femur, and I start to feel a little bit more stringiness, lumps and bumps and tightness. And as I follow this ridge down this gentleman's leg, I end up feeling a cell phone sized adhesion in his thigh. I mean, this thing was nasty, nastier than nasty. I want to say the size of this book, but that's an exaggeration. It was the size of a cell phone. And it has no correlation to him sitting, okay, with the cell phone in his back pocket as to why I use that analogy. I'm just talking about the size. All right. As I started to press into that adhesion, what ended up happening, he started to feel the pain that he normally feels in his lower back. And I was confused for quite some time until I came across the Anatomy Trains by Thomas Myers. And he showed a very specific anatomy train. I can't remember which one it is, where it goes from the thigh of the leg to the glute to the opposite side back. And this is what I have always characterized, especially in the back pain Bible, about being the X pattern of our locomotion, of our movement pattern. Okay. We step into the floor with our right foot. That force gets translated up the chain, up the right leg to the left side back, and then goes to the left shoulder and the left arm. Right. So Thomas Myers proved it with his Anatomy Trains book. So I started working in that area, and the more that I pushed and the more that I dissolved that adhesion, his back pain started to get better. After that session, he was around 50 or 60% better. He came back for one more, and I haven't heard from him since. I gave him homework, taught him how to make sure that that never comes back. I showed him exercises and whatnot to continuously dissolve it, but I got him to around 90, 95% pain free, and then the rest was up to him, and he was totally happy with that. So this is one of those, I've only seen, I want to say, 2 more cases since 2017, 2018. It's 2025 right now. I've only seen 2 more cases where a massive adhesion in the thigh was contributing to back pain, or actually a problem and contributing to a symptom of back pain. All right. So this just shows, man, the entire body's connected. A lot of times there's a lot of factors that we need to look at as to why the body's doing what it's doing. And we need to be curious, like I've said in my previous Tales from the Table. People are so worried and they're so timid about searching in their own body for pain. When I started doing this, my knees were in so much pain. I was like, I was numb to it at that point. I mean, I was getting injections into my knees. I was getting prolotherapy. I was getting PRP injections into my knees. They would feel great. I mean, I was on top of the world for like 3 to 7 days. But then once all of that inflammation would kind of die down and my knees went back to looking normal, the pain would start to creep in and come right back. And that's because my knee pain was in my quad, like I show people in the back pain Bible. All right. Next week, we're going to go into somebody that I just recently worked on. And if you have knee pain, this case is going to blow your mind. This is only the second guy that I've worked with that has had knee pain because of this one specific issue. And it just once again shows that, we always need to search everywhere around the joint in order to find the root cause of our pain. And that's what we're really after. We find the problem, we find that root cause. I guarantee you, within 2 to 3 weeks, you're a totally different person already. All right. All these other people out here saying, I saw a post, I'm going to put something up on Instagram. I have the same name on Instagram if you want to go and check me out and follow me there. Post short form content there, obviously, but I'm going to put up a post there. I found some gentleman showing exercises, these cute little exercises that help with glute tendonitis. Guys, girls, aliens, there is no such thing as gluteal tendonitis. But he's claiming that if you do these cute little exercises of his, it could be gone in up to 3 months. Guys, I'm telling you, come to me with something, quote unquote, called glute tendonitis, I can get you out of that glute tendonitis in probably 2 to 3 sessions. And it's going to feel 40, 50, 60% better. This stuff, like, sometimes I don't want to be pretentious we're egotistical. But when you have mastered a craft after 25 years, like I have, I feel like you kind of have the right when other people are, and through no fault of their own, generating their own content and trying to help people in their own way, but they're stuck in an outdated model. They're stuck in their own education, where I was very fortunate. I had my education, and while I was going through my education, I was teaching my professors. My professors were asking me, "How do you know this, Chris?" And I looked at them and said, "I'm reading Russian textbooks from the 1970s. Would you like to read them?" "No, no, thank you. No, thank you." And this is a collegiate master's program. My thesis that I did, I sat down and presented it to 4 members of the board of kinesiology at the University of Hawaii. How many questions do you think I got? One. Normally, they're there to tear your thesis apart. Everybody just kind of looked and they were like, and the head of the department was like, "Does anybody have any questions?" Everybody was like, "No, no questions." And then he had one question. I completely nailed it. And they were very happy with my presentation. So it's not a pretentiousness, it's a deep internal knowing. Okay. I have been channeling health information, and I use that term loosely but strictly. I use it strictly with me. You use it, or you take it loosely, because when you start talking about channeling, you lose people. And they sit there and they start thinking, okay, what is this guy going to chant and do some song and dance around me in order to heal me? No, I'm the guy that has one foot in this world and one foot out. And I keep it right down the middle. If you come to me and that's all you want to know is physical pain, I will eradicate your physical pain. But if you come to me and you want to eradicate that physical pain, and we're doing as much physical work as we can to unravel it, we're going to have to take a little bit of a trip into the emotional body, into the biofield, okay? And we're going to have to talk about mommy and daddy issues and things like that. All right. So just know that about working with me if you get curious enough to do so. But I hope you guys enjoyed today's session. All right. Tales from the table about that mysterious back pain that comes from the leg. Who would have thought? As always, love, light, and aloha. And I will see you in the next one.